So if somebody says, I get pills stuck in my throat all the time, what do you think of?
So the first thing that we try to think of is whether or not the process of swallowing either pills, solids, or liquids is happening in the mouth or the back of the throat, and that therefore the disability or the difficulty is getting that bolus from the throat back down into the esophagus. And that's called transfer dysphagia, and it can speak to neuromuscular problems in the back of the throat or in the tongue or in the epiglottis area. If the patient says that I can complete a swallow and then I have trouble with a sensation in my chest or in my neck with food sticking, pills sticking, then we call that transit dysphagia. That's a problem getting that bolus to go down the length of the esophagus so that it can clear and get into the stomach.
So really there's a differential diagnosis wherever the person is having the trouble from your standpoint. So if they frequently have trouble with swallowing tablets, pills, how do you guide a person toward successfully swallowing properly?
If we've done an evaluation and we know that there's not a narrowing or a process that is causing those pills to hang up that we can mechanically open for them, then we simply try to coach them on the fact that pills will commonly get stuck in people when there is no problem, actually. There are some anatomic areas that are located within and outside the esophagus that will just cause pills sometimes to naturally hang because they're shaped funny or they're long or they're large. And some of the ways to help them to get beyond that problem is to encourage them to help open the esophagus by using something carbonated to distend it and therefore allow the pills to fall straight through. In other words, straighten the esophagus as much as you possibly can before the pill goes down. The other thing that they can sometimes do, and that is commonly done, is to mix the pill with some sort of viscous substance like yogurt or pudding so that essentially that substance will pull that pill down as the esophagus squeezes down.
Is there anything mental with, I know this is going to get stuck in my throat, I've tried this pill before and it's just too big. So if you get something to help the bolus pass by the throat, would be helpful?
Correct, yeah, and a lot of people will say that. They'll say that they begin to fear the fact that their large pills or vitamins sometimes may have difficulty getting down and they don't like the sensation when it gets stuck. So if you coach them with some of these techniques, sometimes it makes it easier, it becomes a positive reinforcement, and they learn essentially how to get these things to go down with greater ease.